Greetings and welcome to another edition of Medical Update. I'm your host, Walt Culbertson, and if you're a long-term viewer of the show and you missed our last episode, very sadly you missed the goodbye of Miss Gloria Steinberg, who hosted the show for 20 years without ever missing an episode. Glo was a tremendous asset to our healthcare community and did a fabulous job over so many years of hosting this very important show. I had the great honor of being able to be on the show with Glo over 24 times, and during that I saw firsthand what Glo brought to our community. Glo is retired, gone off to Chicago to be with her family. I tried to convince her that they had that migration thing a little bit backwards, meaning that her family should have been coming here to Jacksonville, but I know that Glo is going to have a wonderful new life in Chicago with her daughter and her grandchildren. So much thanks, Glo, for all you did for our community. We're going to pretty much keep the format of the show like Glo had it, except we're going to add a new feature. We're going to have a website, medicalupdateshow.com, which I will get up and running in the next few weeks. And we encourage you to interact with that show, and I'll talk about that opportunity a little bit more at the end of the show. So imagine the scene. You're a healthy person. You take a lot of time to exercise. You take evening walks. A few weeks earlier, you even were actually out in the woods walking with your family. But all of a sudden, you start to feel fatigued. You have headaches. You're dizzy. You can't quite understand, because you are so healthy, what's happening to you. To make matters worse, as you attempt to seek care and find out what's wrong, you end up on an interesting journey that sometimes leads to mystery more than resolve. And so what we're going to talk about today is a very serious disease called Lyme. It is, in fact, one of the fastest growing infectious diseases in our nation, and very challenging for our physician community. It can very much be an imposter, basically masquerading as many types of illnesses. So it's a huge challenge. We're going to focus the next two shows on this very critical disease because it is that time of year. We know we've had a very warm winter. And the fact is, what we do know about Lyme is that ticks are often the carriers. So it is that time of year. We as Floridians are used to living with critters, but this is one that we can probably do without. So on today's show, we're going to have a patient who has learned to live with the disease and have lived that journey I just described in terms of being diagnosed and treated. We're also going to have one of the leading persons of the Northeast Florida Association for Lyme Disease also on the show. In our next show, we're going to have an immunologist and a physician who are at the front lines of battling this very critical disease. And so with that, it's my great pleasure to welcome to our show today Ms. Julie Klapstein. One of our leading area CEOs, now retired, but still very active in the community. And she recently has found out this journey and how difficult it can be. We also have on the show today Miss Amy Boggs, who is the president of the Northeast Florida Lyme Association. Welcome, ladies, and thank you so much for being on the show today.
Thank you, Walt.
Thank you so much for having us.
You're quite welcome. So Julie, one day you're hop, skipping, and jumping. The next day you're in the hospital. Or is that how your journey really happened?
Well, it happened, the beginning was really about July of 2010. And as a CEO, I travel all over the country. I'm frequently on airplanes in different cities. And I remember being in Dallas. We have an office there. And I was exceedingly tired that night. And I'm really a go person. I exercise every day. I'm always healthy. And I thought, what in the world? It must be all the stress and excitement of what we're doing lately. And I went to bed, and my feet and hands were tingling, toes, fingers, tingling. And I thought, what in the world? And over the next few weeks, it started getting worse. And they were burning, and it was traveling slowly up my arms and legs.
So it started at your extremities and kind of felt like it was traveling through your body.
Yes, and I noticed that I was extremely, unusually fatigued. And the fatigue kept getting worse, and I almost felt like I was in a fog. And so I went to my primary care physician, of course, and I tried to act like it really didn't exist. It would go away. It didn't. So I made the appointment and got in there and saw him, and he did several tests, including a Lyme test, and they were all negative. He said, I believe you, there's something wrong, but you're going to have to see a neurologist, a rheumatologist, and you're probably in for quite a long search.
Wow. So what is a Lyme test, Julie?
Well, I don't know exactly what is involved, but there's a couple of different ones, and they go to various labs.
So they take your blood?
They take your blood just like a normal test, and for a lot of other things, and mine came out negative. You know, we'll get into that further, but apparently that's quite common with Lyme, that it doesn't show up on the normal tests.
Well, prior to that, Julie, did you have any other symptoms? Did you find a tick on you? Did you see a red area? Was there anything that you noticed abnormal?
No, I didn't see anything. I don't remember being with a tick. In any sort of way. I've seen them on my dogs.
Yeah,
we have a couple of dogs.
Maybe it's with you, right?
Yeah. And you know, I've been in Florida for 11 years. I hadn't heard about Lyme disease being around Florida. And so when the test came out negative, on to the next thing. And the symptoms started getting way worse. And in fact, I started having extreme cramps, numbness. I would put my arm down and it would completely fall asleep. I started getting really significant headaches, very unusual. And the tingling and burning, believe it or not, traveled right into my brain. I could feel it going on. And pretty soon I started having electrical shocks through my system. And then my legs started getting, and arms started getting all weak and rubbery. And the fatigue continued to get worse, to the point where I was out one weekend, and the reason I could not get into a rheumatologist and neurologist it was actually several weeks. And I said, well, my upcoming executive physical is coming up, so I'll just do it there. And actually it was the weekend before I actually could not walk. My legs were so rubbery, and I had to check myself into the hospital. I was there 3 days and had all kinds of different tests, saw so many different doctors, and they checked me out and said, I'm absolutely fine. Take these pills to help with your neuropathy. And I looked at the doctor and I said, what would you do if you got told you were perfectly healthy and you knew you're not, that you actually believe you're dying, and no one can diagnose you? He said,
but they gave you pills.
They gave me pills for the neuropathy, for the symptoms. And actually, the pills did help somewhat. And he told me, never give up. Well, I'm not one to give up.
So the pills actually help with the pain?
In the neuropathy, and the rubber feeling like I just couldn't hold myself up. They helped enough. And then later I was diagnosed, when I finally did see another neurologist, with small fiber neuropathy, which meant, okay, now we believe something's going on, but we don't know what's causing it.
Right. Well, initially your primary care physician suggested that you see a rheumatologist
and a neurologist. I saw many.
and so, but you mentioned that it took too many weeks to actually get in to see them, and
right.
you leveraged this, annual physical that you had.
Right.
So
I ended up actually getting in the hospital for 3 days, and then having the physical anyway. So during that entire period of inpatient, outpatient trips, I probably saw at least 3 or 4 neurologists and an equal number of rheumatologists. And then I continued these visits. And some of these doctors were great, but not once did any of them consider that it could be Lyme disease.
Because you didn't find a tick on you?
And the tests were coming out negative, and they didn't know. They said it's not in Florida. There's no Lyme in Florida.
Well, we know that that's not the case.
We certainly do.
Is that not correct? So how were you finally diagnosed?
Well, I figure that I kind of diagnosed myself, but it was serendipity. I was continuing to have so much fatigue that I could barely make it through the day. I tried not to let anyone but my assistant know. And I said, I have to keep researching. So every moment that I wasn't asleep and fogged out and couldn't remember people's names, or even talk in the evening, I continued to do research. And the MRI that I had, actually the radiologist wrote on there, on the report, and of course I demanded to see it, looks like MS or Lyme. So I had the seed. I'd read so much about it. All my symptoms seemed to point there, even though the tests were negative and the doctor said it wasn't in Florida. And I was in a business meeting, and a business person that came in to meet with me said, you know what? I know about the Northeast Florida Lyme Association, and you sound like you have Lyme. And you need to see my friend, Dane Boggs.
And basically that was the starting point to really understanding what you had.
As far as I'm concerned, it saved my life.
Holy. Now, what kind of tests? You mentioned all these tests you had, MRI, blood work.
Yes.
What else did they try to actually do to diagnose you?
Well, they tested me for mercury poisoning, syphilis, AIDS, I mean, genetic testing. They were very aggressive at all the things that I'd been tested on, and I did go through 2 Lyme tests called the Western blot, and they didn't pick it up there. But apparently this is quite common, that it shows negative on these tests over and over. And I didn't know that at the time. You know, you believe your doctor and what they're telling you, and that, you know, they know. Of course, I know enough to do research on my own, which I had been doing. But finally, when I got to Dane, he said, you know, you may very well have Lyme. And I went to the Northeast Florida Lyme Association meeting. I got in to see a Lyme literate MD, and Dr. Shirley Hartman, who you'll have on the show. And she said, this is a clinical diagnosis. It is very high likelihood you have Lyme. She has some additional tests, and she called me, and I remember the excitement in my husband and voice, because now we're talking 18 months of no diagnosis, anxiety, you know, all of these things getting worse and really affecting my life and my job. And she calls you and say, you have it. And then I just didn't even believe it until I took a round of antibiotics, and all of a sudden the fatigue lifted.
Right. Well, we'll definitely talk more about what they actually did and how they got you going. But Dane Boggs, I think that must be some relation, I'm assuming. And Amy, I'm also assuming that as a child you did not want to grow up to be president of the Northeast Florida. So tell us a little bit about how you got involved and your connection to Dane.
Well, he is my husband. Married a very long time, and have enjoyed a very active lifestyle. We're both athletic. Dane's a great cyclist, skier, and it goes back a number of years. And he just was chronically fatigued, profound fatigue, needing to sleep hours each day, and sadly, upon awakening, still the exhaustion existed. So this had been going on for a very long time, and yet trips to the doctor were indicating there was nothing wrong. Basically, he was getting older, and maybe he was just depressed. And this went on, and finally, it was to a point where he consulted with another doctor, and very gratefully, this doctor suggested, though she had not really treated people for Lyme disease, she suggested that he might be tested for Lyme disease. And we're very grateful today. Didn't realize how infrequent it was, but he did test positively. We believe Dane had probably had it for years, and maybe had 2 separate encounters with a tick, because we do remember that one time it exhibited. And in about 40% of the cases, less than half, the actual site where the tick would be make contact, it can leave what is called a bullseye rash. But majority of cases never will see a rash, may never even be aware that they've been bitten by a tick, just as Julie has no information about that.
So Dane did actually see that?
He did, in fact, but it was explained away as a spider bite. But he had many years previously, exhibited the symptoms of Bell's palsy, which can be a reaction with Lyme disease. But again, he powered through, and then must have just, sometimes when your immune system can be compromised, your symptoms can really flare up. So fast forward.
But what time frame was that, Amy?
This was going on in 2005. 2005. And
you lived here in Florida?
Oh, yeah, oh yes, in Florida. Yes.
So there's no question he contracted the disease here in Florida.
Yeah, there could be a little bit debate as to when he thinks he was initially, but the second time that it happened, we were absolutely not traveling, and that's when we know that he had exhibited the bullseye rash. So what did end up happening, he got this positive Lyme test, and we were elated, just as you were.
And again, that was a blood test?
His was a blood test. It was, which there are certain labs that are known for being more sensitive with Lyme disease. There's actually a lab in California that was recommended to use. So we had a name of a disease, which neither of us knew very much about. We weren't really telling anybody. But then we thought, okay, we've got a disease. Why don't we go to another institution here locally, since this doctor really doesn't treat it? And I'll never forget, I went on this appointment with Dane, and we were sitting in the office, and the doctor came in, and we explained that he'd just been diagnosed with Lyme disease, and the doctor took one look at Dane and said, well, I can just look at you and tell that you don't have Lyme disease. And we both looked at each other, and we were just incredulous, like, what do you look like when you anyway, right. So it was what I often refer to as entering the twilight zone. It really began that afternoon. And certainly that physician said, that they would discount the test results that we had gotten, and they would need to do their own round of testing. And wouldn't you know, that testing showed up that he tested negative for Lyme. So we left that meeting really just wondering, oh my goodness, we're no closer to...
Well, you had to be so confused because on one hand you had
Yes.
the diagnosis,
Right.
on the other hand you had a follow-up that said, no, you don't have it.
By those that we consider
and like
to be...
they could really look at him and tell, just by looking at him he had Lyme or not.
Right.
But yeah, so what did you do next?
Well, I called a friend. Okay, and that's what women do. And called a friend, and she said, well, how'd your appointment go? And I said, you're not going to believe it, but they've told Dane that he doesn't even have Lyme disease. She said, stop right there. She said, I know a woman who nearly died of Lyme disease. She was being treated by another physician but wanted to get local treatment and had the exact same thing told to her. So you need to call this woman. And truly, she saved our life.
And was that a physician?
No, this was a woman who was living in San Marco and who had been treated for Lyme disease, but she was not treated locally, and she traveled to Fort Lauderdale, and that was the Dane's start to getting treatment for the disease. So he figured he would, and he would travel monthly to Fort Lauderdale, and was treated by a Dr. Nina Perlmutter, who was a specialist, you would say, in Fort Lauderdale, of all places. And she'd seen countless people who had been misdiagnosed. And the thing, I mean, it is hard. I've lived the disease for so long now, and I hear these stories all the time, but people that are just getting into this situation, it's hard to convey to them that the information is so cloudy, so controversial in the diagnosis, in the treatment, in the insurance issues that they run into. It is an unbelievable journey. You need a lot of...
It's a nightmare.
You need support. So might I share a little bit about the Northeast Florida Lyme Association?
Yeah,
I will fast forward because it was Dane's treatment. I would like to give the good news that Dane functions very healthfully, and he feels that he's cured. He's not receiving any medicine at this time, and he was really successful with using alternative therapies, which there are several of those in addition to the traditional Western approaches. But what happened for Dane was we learned about, because he was very interested in learning everything that he could, and people were starting to be contacting Dane just because somebody told somebody told somebody, just as we had our journey.
That he had it, and that he was treated, and he actually got better.
Correct. Well, we learned that there was a film that was being created, and it was going to be presented in New York City. I believe it was in 2008. 7 or 8, and he was interested, and Dane's not much of a New York City kind of guy, but to see this film, he was very interested in traveling to New York, where we would see the film called Under Our Skin, which is an award-winning documentary which does a fantastic job of chronicling several patients and all the nightmares,
ups and downs,
ins and outs, and really brings forth the story that is hard to convey. It's a long film, but it does a masterful job. And he felt so passionate that this needed to be shown to the general community because people needed to be made aware of it. At the same time, a very long-time friend of mine, 20 years of a friend, Dane ran into, and she was symptomatic in classic Lyme symptoms, the rash, the fatigue, et cetera, and she wanted to join forces. Sure enough, she was diagnosed with Lyme. She also had a positive test and felt that we needed to do something. And so the creation of the Northeast Florida Lyme Association was really about showing this film. And that was our humble beginning. And we've gained a lot of members since then, but we'll talk a little more.
How did you initially show the film?
Well, it was actually in the Ponte Vedra Library. And we had a great resource. At the time, we do have a connection. The PGA Tour has been wonderfully supportive of our efforts in grant writing, and we always we have meetings there for our board. And at the time, the senior director, I believe he was, of the PGA Tour Productions, very sad, his son suffered very significantly with Lyme disease. So he was also wanting to join our efforts. So he was on our board. He's no longer in the area. So
well, you can kind of understand that because, I mean, you're talking about golfers. Well, where are they at? They're outdoors. Yeah. What are they doing? They're interacting with nature. So it certainly makes sense that there has to be a heightened awareness among at least those professionals of the opportunity and the awareness of something that could happen.
You're exactly right.
Yeah.
So we showed this film. We had a wonderful article that was written locally, and we had a full house for showing the film. In addition, we are so fortunate, Dr. Kerry Clark, who we had met in traveling to learn more about Lyme disease, resides in Jacksonville. He's on faculty at University of North Florida. He heads up their Department of Public Health. He's an epidemiologist. And I call him the rock star of Lyme disease because he has done tremendous traveling and is called upon all the time to speak about, and a lot of his research that we are funding is to improve the diagnosis. So his testing, while it's very manually demanding and hard to duplicate, but he actually is looking for the DNA in the ticks and in blood samples, and has been very successful in his work. But he's done a lot of research work and unquestionably recognizes that it is here in Florida. And if we can only get one message out to people, because I feel there's a wonderful message about Lyme disease, and that is awareness and prevention. This isn't cancer. This is something that can have some knowledge around it, and to avoid getting the disease is so huge.
It's absolutely critical. In fact, on our next show, we will have Dr. Clark.
It's wonderful.
And I believe the physician that you ended up seeing,
yes,
Dr. Hartman.
Dr. Shirley Hartman should be on, and she is what I call and have researched a Lyme literate MD, and she's literally booked up for months because there are so many people in Jacksonville and throughout Florida that have the symptoms I have and others. I had it go into my central nervous system, but there are many other symptoms of this disease, and the doctors, I think some, not enough, but some are starting to realize that the things they're calling MS, chronic fatigue syndrome, fibromyalgia, may in fact be Lyme. And why not go through a few rounds of antibiotics and find out, like I did, that in fact it is treatable.
Right.
Because the medicines that they may give you to treat these other things actually could be detrimental if you have Lyme.
And maybe even mask it.
And mask it and cause even worse symptoms and reactions.
What is Dr. Hartman's specialty?
Well, I'll let you talk about that, Amy.
Well, it's another interesting story. Andrea King, the fellow board member, Andrea was her physician.
Board member of the Northeast Florida?
Member of the Northeast Florida Lyme Association. And Dr. Hartman was her physician. And Andrea took the film that I'd spoken of, Under Our Skin, to Dr. Hartman to just get educated on it. And Dr. Hartman was absolutely aghast. And her awareness was huge after that point. But come to find, and she's told us on repeated occasions, when continuing education that's offered to physicians, when they even get on the topic of Lyme disease, which is a very miniature exposure even about the disease, they pretty much wipe out the existence of Lyme disease in the Southeast, not just Florida. So it's never been, and to the defense of many physicians, they are told. And if they had never heard about it in medical school, because it wasn't really widely known, it's not a disease that's gotten a lot of attention.
Well, again, it's been emerging from the standpoint of even understanding that it is a disease and that it exists not only up north where a lot of people think, but down here in Florida. So is that a big focus of the Northeast Florida Lyme Association, is not only being a resource and education for patients, but physicians as well?
We want it to be so, yes, that so much, and it's very difficult to find physicians. Hence, my husband traveled to South Florida. We have identified, and we do provide for inquiring people with the Northeast Florida Lyme. We give them a list of physicians in and around Florida that they can, who represent themselves as treating Lyme. Many physicians really aren't familiar with it. So
that's your education opportunity. So do you have a website?
We do.
And what is the URL?
Oh, it's www.nefla.org.
Oh, it's a great. That's a great.
NEFLA.org.
Can't get any easier than that.
And I think also, Walt, it's great because it actually appeared an article in the Wall Street Journal about a week and a half ago. So some physicians are getting educated, just more need to be.
An article about ticks and about this
about
being,
Lyme disease and the
again,
prevalence.
with the warm weather, this is going to be a very difficult season for the opportunity, unfortunately, for Floridians and others to catch this disease. So very quickly, what can people do? Do you watch your pets? Do you check for ticks? What's the best thing to do?
Absolutely. So often, it is amazing how people are very commonly unaware or think that they've never been exposed to a tick. But remember, your four-legged animals are outside and exposed. Also, children. Children are really at risk. They're out tumbling in grasses. They get close to ticks all the time, may not be aware of it. So
check yourself.
Check
your clothing.
Check your clothing.
Especially when you come in from outside.
From outside. And the other thing to realize is I just recently got a call from a friend who was walking in a guana and found one tick one day, another tick a few days later. So they can stay on you and you're just not aware of it. But to remove the tick, that's a question that we're often asked. Number one, you do not want to squeeze the tick, but you want to get as close with a fine tweezer and get as close to the skin to remove the tick. Save the tick.
Now, is that all information that you offer at your website?
Oh, yes, absolutely. We have all kinds of great information about removing the tick, about how to just be looking for it, other symptoms of this disease. You touched on many, but this disease can, as you said, masquerade as
But the starting point is for folks to go to your website.
Absolutely.
Very
yes.
good. Well,
NEFLA.org.
That's a great way to conclude the discussion. And again, thank you both so much for being here and being regional pioneers at helping folks understand that. We'll get to your website. Okay. All right. Well, again, this has been another edition of Medical Update. We are going to have a new website, www.medicalupdateshow.com, and we definitely want to hear from you. We want your information, and we want to learn more about how we can help you at Medical Update. Until we see you again, have a great day.
You're watching Public Access on Xfinity 99, exclusive programming for Jacksonville Xfinity subscribers.